Welcome back to my channel and welcome to another Black History Moment. What if the person who trained some of America's greatest surgeons was never allowed to operate on a patient because of the color of his skin? What if he saved thousands of lives, yet remained invisible to the public for decades? This is the story of Vivien Thomas, the cardiac surgery pioneer you've probably never heard of. Born in Louisiana in 1910 and raised in Nashville, Vivien Thomas graduated from high school with honors. He dreamed of becoming a doctor, but when the stock market crashed in 1929, it wiped out his college savings. In 1930, he took a job as a lab assistant at Vanderbilt University, working for a surgeon named Dr. Alfred Blaylock. Despite being classified and paid as a janitor because that was the only job title a black man could hold at the time, Thomas was a prodigy. He learned complex surgical techniques so quickly that within months he was performing delicate operations on his own. When Blaylock was offered the top surgery job at Johns Hopkins in 1941, he made one demand: Vivien Thomas had to come with him. At the time, Johns Hopkins was rigidly segregated. Thomas walked halls where the only other black employees were janitors. Then, in 1943, pediatric cardiologist Dr. Helen Taussig brought them a challenge. Thousands of babies were dying of blue baby syndrome, a heart defect that starved their blood of oxygen. Blaylock had the theory, but it was Thomas who had the hands. For 2 years, Thomas worked in the lab, performing the procedure on 200 dogs to prove it could be done safely. On November 29, 1944, they performed the surgery on a 15-month-old infant named Eileen. Because black men were not allowed to operate on white patients, Thomas could not hold the scalpel. Instead, he stood on a step stool behind Blaylock, guiding his hands through the entire surgery, coaching the chief of surgery on exactly what to do next. The surgery was a success and revolutionized heart medicine, but when the results were published, Thomas' name wasn't mentioned. It was called the Blaylock-Taussig shunt. It took over 30 years for Johns Hopkins to honor him. In 1976, they awarded him an honorary doctorate and made him a faculty member. Today, historians recognize the procedure as it truly should be called, the Blaylock-Taussig shunt. Vivien Thomas proved that genius isn't confined to a diploma. He didn't just change medicine, he broke the barriers with his hands, even when society kept them tied.